This is the first HS panel meeting of the Year of the Monkey. So let us call the meeting to order. We will now invite the government representatives to come in. And the secretary is busy. He hopes that he can leave at 5:30. So let us start the meeting. We have a quorum, and I'm sure you have noted that there was one information paper issued since the last meeting. As for our items for discussion at the next meeting, one is organ donation and the other is expansion of Haven of Hospital. And some members have been talking about elders who are suffering from hearing impairments. So this may become one of our agenda items. Secretary, Happy New Year and good health. Please come in. And we can start the meeting. So for our next meeting, it will be held on the 21st of March. This is the provisional agenda, and we may also be talking about elders with hearing impairments. So let us start our discussion right away. Prevention and control measures against Zika virus infection. We have read the paper, so the secretary has to leave at 5:30. So let us waste no more time, and we can start asking questions right away. We have 5 members who have raised their hands, and each member will be given 5 minutes, and also Mr. Albert Chan, 6 members. Secretary, thank you for attending the meeting, and now let us ask our members to raise questions. Thank you. The secretary at our oral questions times has answered a lot of our questions, but now we have seen a case. A person has traveled via Hong Kong to the mainland, so I'm worried. Now this virus now exists in South America and also in some other places, for example, Thailand or Malaysia. But if there is a major outbreak, Hong Kong stores are open. So we're not just talking about people who are visiting Hong Kong. There are people who are transiting through Hong Kong, for example, going to the mainland, and there are numerous of them, and many of them are asymptomatic. The secretary knows this very well. Some of them are not aware that they are sick unless you have tested them positive or they are very sick. Otherwise, you may not detect them. Now we have identified one case, but it doesn't mean that there's only one case. Maybe there have been many cases already, but the patients are asymptomatic. So we do not know anything about them, and this is a serious threat. So if we look at the present situation, now we have seen a case passing through Hong Kong. So would the government do something to enhance our security, for example, at our borders, at the airports? Will you do anything? And when will you consider issuing travel alert? Well, last time you remember the Middle East SARS. If we wait for the WHO's intelligence may not be as fast as ours if that case happens in Hong Kong or on the mainland. So we cannot wait for Geneva. We have to work by ourselves. So do we have a set of standards as to when we should issue travel alert? I don't think we should wait for WHO, which is thousands of miles away. So I have 2 questions for you. Secretary, as I said earlier, well, the Zika virus, because 80% of the infected people are asymptomatic. So for our pot control, we cannot do much because we cannot rely on the traditional ways of detecting them. No matter what, for our pot health measures, we still attach a lot of importance to them. So when it comes to pot facilities and mosquito control, we would step up our efforts in those areas. And later on, I will ask my colleagues to give you more details. The most important thing is this. That is, the authoritative infection control agencies in the world have always said this, that is, the control and prevention of mosquito is very important. So for the affected areas, they have to do a lot of mosquito control work. And for ourselves, we have to raise the awareness of Hong Kong people. We have to step up publicity and education for pregnant women or women who are preparing to have babies. They should be very alert if they are going to visit the affected places. And for those who are really visiting the affected places, they have to pay a lot of attention to mosquito prevention. And when they come back to Hong Kong, they should also be very careful. Well, the transmission is made through blood transfusion or sexual intercourse. So we would remind travelers who come back from these places that they shouldn't donate the blood within a period of time, and also when they have sexual acts, they should take preventive measures or contraception. And if you have been bitten by Aedes albopictus, and there may be a chance of secondary spread. So for those who have visited the affected areas, no matter whether you have symptoms or not, you should prevent mosquito bite in Hong Kong. I have asked you two very clear questions, Secretary. We have seen a mainland case lately. So what special measures would you have in place? And also for travel alert, when will you trigger that mechanism? How about a travel alert? As for travel alert, the WHO made it very clear that is at this stage they would not consider imposing any travel alert or trade restrictions. But for us, we think that travel restriction or alert are not necessary at the moment. We think the most important thing is the measures that I mentioned just now. As for our ports, it has to enhance its measures. Let me invite my colleague from the Department of Health to speak. Dr. Leung, for the Port Health Office, it has already stepped up its work so as to ensure that the environmental, hygiene, and mosquito control work are carried out properly. And also, they have trained relevant staff so that they can pay more attention to the work. And also, the Secretary said that advices will be given to travelers. This will be done through their staff or through the agencies, or people can also get the relevant information from the Department of Health's website.
Thank you, Chairman. In the paper, you also mentioned that in 2013-14, there were some large-scale drills, and it's also mentioned that the Zika virus actually is transmitted, through the same in a similar ways like what happened to dengue fever. Therefore, you have had the interdepartmental drill. So I'd like to know more about your time arrangement. When will the drill take place? And also, the virus itself is transmitted via mosquitoes, and you've got anti-mosquito arrangements. So my question is, on construction sites, where there have been problems caused by mosquitoes. Last year, we saw the outbreak of dengue fever due to mosquitoes. And you now rely a lot on the contractors to keep the construction sites problem-free. Would you then liaise with the developers or contractors at construction sites to make sure that they would adopt anti-mosquito measures? Or, they can face the risk of penalties? So, for the purpose of safety at construction sites, what more would the government do? As for arrangements for drill, I would ask the colleague from the FEHD to supplement. Thank you for your questions. The Department of Health carries out public health drills to enhance coordinations amongst departments. In 2013-14, we actually carry out activities targeting dengue fever and diseases spread by mosquitoes, and 3 departments were involved in our drills. As for enhancing coordination among departments and tracking of suspected or individuals who are suspected to have been infected, contingency plans among departments, we've actually been to actual sites to see whether proper measures have been undertaken. Since it's the same kind of mosquito that spreads this kind of disease, after the last drill, we felt that if necessary, we could indeed carry out similar drills. But at this stage, I think the most important is we need to ensure that the relevant departments in the days ahead, FEHD, of course, as the Secretary said, has announced 3 phases of anti-mosquito work. I think we need to actually carry out the anti-mosquito work first. Mr. Falk? Yes. Targeting construction sites, the FEHD will continue to liaise with relevant departments, for example, Civil Engineering Development Department, and other government departments we will have regular meetings to alert them to the importance of preventing mosquito-bred diseases. Our colleagues on a weekly basis will carry out checks at construction sites. Once we've identified problems, we'll try to get improvements done. And if we see any mosquito bases there, we'll actually lodge prosecutions. As for the anti-mosquito campaign, the first phase of the first phase in the first quarter this year actually will start on March 1st, and actually it's on till March. As for anti-mosquito measures, in 2015-16, in the winter, that is from last December till March this year, we have increased the outreach teams at the same number that in the summer of last year, that is 266 teams. Is it that every week you carry out checks at construction sites? Yes, according to our guideline, our colleagues will, on a weekly basis, go to construction sites for checks. Yeah, let me supplement. Basically, we don't need to add any more new measures, because once we found any actual mosquito problems at construction sites, there's already a violation of the law and prosecution is warranted. Next one. Mok Mei Kun, can you hear me? I want to say that even though the government has done a lot of publicity against the Zika virus and also preventive measures, but lately, during the New Year, when we went to extend New Year greetings to people in the neighborhoods, I found that many people in the various districts were not aware and they knew little about this disease. Even when we went to potter plants in gardens, in parks, people there are unaware of taking any precautionary measures. So I want to see where the government can step up its publicity and education to let the public know about the importance and make the public be better aware. Dr. Leung? Yes, I very much agree that we need to step up our publicity. So besides the leaflets, posters and information uploaded online, we are now planning to come up with a API, which will be released in February and March. We hope that through existing channels and also district networks, and hopefully through property management companies and district councils, we'll try to spread the messages more, to various districts. Sorry, I've lost my voice. But, the school term is beginning again. small children nowadays can influence their parents. Maybe I can liaise with the Education Bureau and let small children know about the importance of taking anti-mosquito measures so that they can inform or pass the message to their grandparents and parents. Yes, we'll do that. Elena Wong next. Chairman, this morning we heard a news report that in Brazil and Latin America and some countries there, where there are more cases of Zika virus infections, a new development has occurred. That is, there's a new disease that has been on the increase due to the infection. So there may be not just Zika virus infections. The virus itself could cause patients to develop other diseases. With this new development, maybe, our awareness of the crisis and preventive measures need to be stepped up. In paragraph 7F, you talk about the health promotion at BCPs will be enhanced through pamphlet distribution and poster display to remind people of the preventive measures. But people have noticed that the publicity being carried out at BCPs were focused on actually Ebola virus, and they had nothing to do with the Zika virus. The Brazil Olympics is on its way. It will happen in half a year's time. And, mainlanders and other people would go to Brazil to watch the Olympics. Athletes will go there. Hong Kong athletes or tourists from here or mainland athletes would go there via Hong Kong. That means there could be a higher risk of the virus being spread to Hong Kong. So what sort of preventive and other measures does the government have to tackle it? Okay, I will answer this first. I think earlier on, through the media, the public became more concerned about these cases of microcephaly. But if you've noticed that it's pointed out already that there's actually another kind of disease that's caused by this Guillain-Barré syndrome. Yes, it's also caused by that. Therefore, all along, we have paid much attention to either microcephaly or Guillain-Barré syndrome. And in our publicity and communication, we've pointed out the possibilities of developing those diseases. As for the airport publicity, on the one hand, we need to prevent the occurrence of new diseases, but we cannot actually reduce our publicity on other risks, of getting other diseases. So at the airport and BCPs, we would try to update whatever information that needs to be conveyed to the public. And our Center for Health Protection is also concerned, besides reaching out to the travel sector in the time ahead when there are athletic delegation going to Brazil, or if there are other members of the public attending the Olympics. We will continue to strengthen our ties with the travel industry, and also through our sports commissioner, we will actually ensure that adequate prevention will be taken by the athletes from Hong Kong. As for the publicity at the boundary control points, when will those latest pamphlets be made available? Yes, at the BCPs, posters, leaflets. We will try to actually, the pamphlets are not there yet, but we will step up publicity at the airport. We've got the pamphlets and posters done. Yeah, they're there now. Yeah, they're there now, the BCPs, but it's just that for broadcasting of the messages, we'll need to get the broadcasting done as early as possible. Earlier, we had already contacted athletic organizations, and we've learned that some athletes will attend the Olympics, and we've contacted them. We've also liaised with the sports commissioner and tried to get him use his channel to increase publicity of the messages. Chairman, can I ask questions again? Okay, you can just provide this supplementary information to us. All along we've heard that there's a strong link between Zika virus and microcephaly. That's the message the public has got. But now you've told us that the syndrome, the Guillain-Barré syndrome, could also happen. So can you, in your publicity materials, cover both diseases? Because otherwise we're thinking, well, I'm not going to get parents, I don't need to take any precaution. Would you think that you need to actually adjust your focus? Yes, I think in our communication we've covered both diseases. Me personally, I actually said it in person, but actually what you see in the media and also wire reports and also in media images that the public have seen, they tend to focus on the problem of microcephaly. But we have actually covered both diseases in our messages. Okay, next one. We are worried about the Olympics that's coming, to be actually coming up, and we can't believe that there's a chance the Zika virus could be spread to Hong Kong. So we hope that the administration can take adequate precautionary measures. I want to talk about your anti-mosquito work. In the past, the administration has sent teams to various districts. But I'm worried about in the new territories, where, there are private lands. That in the new territories, there could be some remote areas that have been left unoccupied. Even the landowners are living abroad, and there's no way, they can look after their land. So for this remote vacated lands, what would you do with them? And also, some village, residents, they may, comprise a large space and only inhabited by 2 elderly people. So can the government actually go and help these old people living in village areas to help them kill mosquitoes? When dengue fever first erupted, the government did help eliminate mosquitoes, but now find that it's very difficult for the residents to get any anti-mosquito equipment from the contractors. So can I ask the government, how are you going to carry out your anti-mosquito work in the new territories? I'll ask the FEHD to answer this. Thank you. Our anti-mosquito work actually centers on public areas. In the new territories, in principle, is the property owner's responsibility to kill mosquitoes. But if that's not done, we actually have the right to go to any mosquito-beating areas, and when resources are available, we can actually step in. But if there are people who are supposed to be responsible for the anti-mosquito work, then they should be doing it themselves. If the people involved have no knowledge in the area, they can invite, or get the anti-pest or pest control companies to give them a hand to do the work for them. Well, we are talking about, publicity about public health, even, messages related to public health. If villagers voluntarily carrying out the anti-mosquito work, then would the government, for example, distribute mosquito nets to villagers? If you ask the villagers to find pest control companies to kill the mosquitoes regularly, that may not be easy to be done. There could be some elderly singletons who live in villages. What can they do? Can the government do more to help them?
Yeah.
Secretary. Just now, our FEHD colleagues has told you what they would be doing. And because for all the private lands in Hong Kong, if the government is supposed to help prevent and control mosquitoes on those sites, then it would call for a lot of resources. But if there are some special cases, for example, some vacant sites and people just cannot enter them, or there are elderly people who are living alone, then we can think twice. We may liaise with the district officers there and see what we can do. Because there are also buildings that have no management. They are special cases, so we will try our best to help them. I hope that you can properly monitor the mosquito control teams. So how does the government monitor them now? How do you assess the effects of their work? Do you have an indicator, or would you double check their work? FEHT colleague, Mr. Falk. For the mosquito control teams, they have supervisors, so they will be responsible. And also we have monitoring officers. We have also frontline officers monitoring their work. We would also receive complaints. We would talk to village representatives, district councillors, and when we do inspections, we would also look at the situation and assess their work. I think mosquitoes know no boundaries, so I hope the FEHD can do a better job in terms of mosquito elimination in the new territories. Mr. Albert Chen. For the Zika virus, Hong Kong people are not too aware of it. Over 80% of the people infected may not feel it, or even their test results may not be positive. So I think there is a potential risk. Even if it's not higher than the viruses we saw in the past, it cannot be lower because the detection rate is really low. And when there are really problems, the danger may even be greater. And this would also affect pregnant women seriously. The consequence may be even more worrisome. So what can the government do more? We are very clear that this is a mosquito-borne virus. In the past, when we talk about dengue fever, I have talked about this many times. As the secretary may know, I live in a village house, and septic tank is a breeding ground for mosquitoes. I have talked about this many times at LegCo, but I haven't seen the government do anything about septic tanks. There's no promotion and there's no actual control work. In the summer, when you look at septic tanks, you can see a lot of mosquitoes breeding. I remember once I killed 130 odd mosquitoes within an hour. It's really outrageous. Now it's winter, there are less mosquitoes, but there are still mosquitoes. I stayed at home more during the Chinese New Year holiday, and I also killed a number of mosquitoes. I understand that the government is now sending more mosquito control teams to the new territories. But you have to deal with the source of the problem. Even if you spray mosquito repellent, the effect is not as good. So you have to target the source, in particular septic tanks. You really have to come up with a method. Now, I have a method myself. That is, I would cover the vents with mosquito nets, but a lot of people don't do that. I even distribute mosquito nets to my neighbor, but many of them don't really pay attention to it, and they do not cover all the vents or outlets. So I think people are not too aware of mosquito preventive measures. And I also want to ask the government, would you catch the mosquitoes and check whether they have the virus or they have Zika virus on them? Would you do that? Our FEHD colleague and Mr. Chen both say that there are methods to prevent the breeding of mosquitoes at septic tanks. I understand that some people may not be too aware of this, and I agree with you that there should be more promotion and education. So maybe I can also ask our experts to answer your questions. Well, for septic tanks, actually it's a very simple problem. Now you have teams going to the new territories. You just ask your team members to cover all the septic tanks. It's a very easy job. And if you do it in all the areas in the new territories, then I think it will be very effective. Let me ask our expert to answer your question. Mr. Yun. As for septic tanks breeding mosquitoes, well, those mosquitoes are not Aedes albopictus. I think there are Aedes albopictus. Well, actually they breed other types of mosquitoes, but we still want to prevent the breeding of them. And there are two ways of doing it. Like you said, you can seal the vents with a mosquito net, or for the cover, maybe there are places with holes, so you should mend the holes. And also mosquitoes can lay their eggs on the water, so you can throw breads onto the surface of the water, and a film can be formed on the surface of the water. Then mosquitoes cannot lay eggs on them. So we will be distributing pamphlets at villages. We will be advising the villagers what they can do. So when we carry out inspection, if we discover problematic septic tanks, we would advise the villagers to take measures. For example, to throw breads into septic tanks so that the mold can form a film on the surface of the water. Mr. Chen wants to know if you would catch the mosquitoes and check them. For example, the Aedes mosquitoes in Hong Kong. Would you try to catch them and test them and try to find out whether they are carriers of Zika virus? Do you do this in Hong Kong? Thank you, Chairman. Well, for dengue fever, we have already been doing that. That is, we will catch mosquitoes and check them. As for Zika virus, we will double check with our laboratories. We will try to catch mosquitoes and check them and see if we can find out whether Zika virus exists on them. But because only 20% of the infected people will develop symptoms, so we don't know what the mosquito condition is like. So for dengue fever, you have done that, right? You would catch mosquitoes and check them. Yes, we will try to find out the feasibility of checking mosquitoes for Zika virus. I think Mr. Chen is very interested in this. That is whether you can check mosquitoes and find Zika virus on them. Yeah, we will try to look at the feasibility of doing that. As for mosquito prevention, you say that you will step up promotion and you will advise people to throw breads into septic tanks. I think that's a waste of time. You're sending teams to the new territory, so why don't you just do the job? And don't be too bureaucratic or frigid. I think you should just do it. It's very easy for the FEHD. I have never received any publicity material from you telling people how to deal with their septic tanks. So please try to really do something. I think that's not enough publicity in the community. A lot of women are still unaware of this. So I think you should really step up your publicity for pregnant women and women preparing for pregnancy. They should try their best to avoid going to affected areas. Now it's the winter, so it seems that people do not care too much about mosquitoes. However, in the new territories, there are still problems. For example, Ma On Shan, the mosquito index has always been high, so it's really very dangerous. When it gets warmer, you must step up your mosquito control efforts. When I read the government's paper, you tell us what you've been doing. However, if there is really an outbreak of Zika virus infection in Hong Kong, I think the most affected people are pregnant women and their fetus. And lately, the temporary guidelines has been issued by the College of Obstetricians in Hong Kong, and it is suggested that for those who have been to the affected areas, they should be very careful, and if there are any problems, they should check their blood, etc., and do all sorts of tests. So I understand that there are no risk tests for pregnant women in Hong Kong. So do we have the relevant technology for checking pregnant women for Zika virus? If not, can we try to find a way to do that? And for that guideline, it hasn't mentioned anything about abortion. So if in case a pregnant woman, after being pregnant for 30 weeks, it is discovered that her fetus has microcephaly, what will be done? Dr. Lau? Well, I will tell you what we have been doing. Now, for our obstetricians, they have been working very closely with the Hong Kong College of Obstetricians, and they have formulated guidelines. This is a temporary guideline because now the situation is still changing, so we do not know what will happen to the affected babies when they grow up at the moment. Obstetricians would advise pregnant women if their cases are complicated as to whether there should be abortion. A lot of factors will be taken into account. How would the health of the fetus and the woman be affected? All these will be taken into consideration. There are still a lot to be known about Zika virus, so we will try our best to collect information, and we will update the obstetricians about the latest situation. So can blood tests help? If you test the blood of a pregnant woman, would you find Zika virus? Is it possible? Well, if in the past 14 days a pregnant woman has been to the affected areas, then she can undergo a blood test, and we can find out whether she's contracted Zika virus. So blood tests can help, right? You can find out whether a pregnant woman is infected with Zika virus and whether her fetus is affected. We can find out whether she's infected acutely, but as to whether the baby is infected, the doctor will do a series of tests, for example, ultrasound tests, and also other more detailed tests will be conducted. Now, if you talk about testing the fetal fluid, danger may be involved. So are there new technologies to do this? Well, maybe I can summarize, Chairman. Yes, for blood tests, you can use it to find out whether a person is infected with Zika virus. However, at different stages of infection, the blood test results may not be 100% correct. even though a person's test result is positive, it doesn't mean that the fetus is infected. So if you test a pregnant woman and find out that she has been infected with Zika virus, so a number of tests have to be carried out. As for fetal fluid, we don't just do it right away because this is an intrusive examination.
So, Chairman, if the pregnant women have been to those places, then they need to be made aware of the info. Otherwise, if the pregnant women or new mothers, once they've known information, they would actually use them for reference and knew what decision to make. Yes, I've said this many times. Later on, I think on radio and TV, we will provide publicity. Any sort of most effective publicity, I think, in Hong Kong is to make good use of the mass media. Well, maybe the Secretary you could consider stepping up publicity at popular websites with mothers. We have a dedicated web page, indeed. Well, second round for 2 members, Poka Key and Helena Wong. Poka Key first. Secretary, I understand that now is not the appropriate time to decide, for any travel alerts. I tried to be fair. I was just trying to ask you, under what circumstance would you consider issuing a travel alert, and also what sort of criteria would you use at what stage of a crisis? Like, for example, in Southeast Asia, if, in some places where there are lots of mosquitoes in Southeast Asia or Thailand have been isolated, mosquito-related diseases. If there's a widespread outbreak of disease, would you consider issuing a travel alert? And also, secondly, Dr. Leung, from the Department of Health, you just then said that at the airport there will be, information for target travelers like pregnant women, and also distribute some publicity materials to them. Is that right? And thirdly, the Secretary has all along mentioned that mosquito control is the most important. In the past, we've only seen so-so results from mosquito control work, and this year we've seen double attacks. And the government is going to begin its mosquito control work earlier. But since we've only got, so-so results in the past, so do you see if there are any areas where improvement can be made? I don't want to focus on the technical side, but in terms of resources and manpower, do you think you would increase them compared to last year? Besides FEHD staff, would you try to outsource some of the work to try to achieve better results? Helena Wong. Yeah, obstetrics, just then you mentioned that there are some guidelines issued by the obstetricians. Could you actually tell us or give us the guidelines in writing? And as for mosquito control, based on some observations in Kai Tak area, we have contacted actually, FBHD, and we've seen in some public housing estates there pest control, mosquito control work is done by management companies. But people from the property management companies have little knowledge when they actually carry out inspections at rooftops. The company involved will only just put an old soap in some drench. They say that acidic materials can kill mosquitoes. I've never heard anything like that. So would the government contacted management companies responsible for public housing estates and private estates and try to make sure that their knowledge is scientific, when it comes to mosquito control? Otherwise, these companies may not have done anything at all that's effective. And also you can contact some landscaping companies to get advice from them on what sort of plants should be grown in housing estates, because FEHD colleagues have told us that there are some plants that should have been very dense plants that should have been grown in the estates, because they tend to attract mosquitoes or provide good breeding ground for mosquitoes. So do you think that, have you been to, these landscaping or the pest control companies to see where they really have adequate knowledge? Okay, Secretary, as for travel alert, where there's a need for it, I think we will consider a host of factors, including, for example, places where Hong Kong people often go to. But there are also factors as well, like whether there are any new scientific evidence or information related to the disease, spread by mosquitoes. And WHO 2 days ago also added Thailand to its list of affected areas, which means that there could be the chance of continuous spread of the disease in Thailand, even though it's on a lesser scale than in other places. So there's a sign of the disease being spread continuously in Thailand. So Hong Kong, Philippines, and in Southeast Asia, Philippines, Indonesia, and so forth, there are signs of the spread, but there hasn't been any signs of continuous spread. Therefore, WHO has not added them to the list. As for the guidelines by obstetricians, since the guidelines are issued by the professional body, so we'll consult the college first. If they have no objection, of course, we can provide the guidelines to you. For the second question, I'll ask Dr. Leung to answer. As for the two members' questions on mosquito control, I'll ask my other colleague to answer. Dr. Leung, yes, as for the our effort to spread the message to pregnant women at BCPs, earlier on our strategy was to actually provide the health information at all BCPs, not just at the airport, because people need to consider beforehand, before they leave Hong Kong, what they should do or where they should go to the various destinations and what precautionary measures they should adopt. So we will continue to follow up on the measures targeting not just pregnant women. And also the disease can be spread through sexual encounters. So for male, if their female partners are already pregnant or could be pregnant, then they should actually be aware of actually using condoms, and also to avoid spreading the disease to their female partners. So we need actually a holistic approach, not just limiting our efforts at the airports. Our actually holistic publicity will cover the mass media and all our district networks, TV, press conferences, press releases, web pages, posters, leaflets, and so forth. So we will actually adopt a holistic approach. How about the effects of mosquito control campaign so far? Yes, when it comes to killing mosquitoes, we know that it's not enough to rely on our own efforts. So in recent years, we've asked community and various government departments and the public to collaborate. Each year, we would have a mosquito control steering committee meeting, and whenever there's any party that needs information and technical support, we'll provide them. And publicity information actually is very important, and therefore in the summer we would actually can see on TV or hear on the radio, our information on mosquito control. And also we have our own staff and outsourced teams who are carrying out the control work. As I said just then, we've never actually reduced our efforts. In 2015, we have kept the number of pest control roofing teams at 2066. And we're going to have the second and third phases of anti-mosquito campaign this year. We also have thematic mosquito control work, and our colleagues will liaise with various district bodies and try to pass on the useful knowledge to the parties to make sure that everyone is collaborating to achieve results. I think Kwok Key's question is very specific. He asked you whether you've increased your resources in mosquito control. And Ms. Helena Wong was asking about, questioning the knowledge of people doing pest control work. What do you think? Yes, in the winter, usually our roving teams actually have fewer numbers. So in 2014 to 2015, we kept the number of roving teams in winter last year at the same as the number of teams in the summer of 2015. As for pest control companies and other outsourced work, you know that we have reached out to other departments like LCSD and Housing Department and to carry out random checks at various places. And we also try to tell the outsourced parties what they need to know if we found that they lack knowledge in some areas or if they're not doing their work properly. So we will actually provide technical support to them. Kwok Key, well, I asked them where they've increased resources. They said they have increased resources because they've increased the number of teams in the winter. Secretary, I think for each department, I think we will, depending on the workload at different times, we will actually allocate resources accordingly internally. I think in the summer, we will concentrate our resources on mosquito control. In the winter, we may use more resources for other purposes. But in the last 2 years, particularly this year, in the winter, we have kept the same number of teams as in the summer. So relatively speaking, you can say that we have increased resources. I think we've had thorough discussion on this topic. Members are worried about or concerned about travel alerts and mosquito control work. Dissemination of information for moms and pregnant women and so forth. I've got a question for the Secretary. There's this saying that there will be a vaccine available soon. Would you consider if the vaccines are available when athletes are going to Brazil for the Olympics? Do you think would they be given the vaccines? Yeah. We've heard actually different news about the vaccines, but from what we know, I don't think we can get the vaccines available within this year. I don't think we can have a chance of getting the vaccines this year. Okay, so I think that's it for this agenda item. So thank you, the Secretary. I think you can leave on time. Now is the second item on the redevelopment of Kwong Wah Hospital. We invite the administration to come in. According to Rules 83A of the Rules of Procedures, if members have any direct or indirect pecuniary interest with this topic, please declare your interest. So now let's invite the administration to come in. So let's welcome the administration. Well, I hope that you'll be in good health. There are some members of us who are unwell today, indeed. Well, this is about the redevelopment of Kwong Wah Hospital. Can the Undersecretary take us through the paper briefly, please? Thank you, Chairman. Let me take you through the redevelopment work of Kwong Wah Hospital. The Kwong Wah Hospital building actually is more than 50 years of age, and it has a shortage of spaces. Therefore, the government proposed that it undergoes a comprehensive redevelopment to increase its HO design and also congestion issue. And we also will provide a patient-oriented environment. The redevelopment plan would actually focus on ambulatory care service and provide one-stop services so as to eliminate the need for people to stay in hospital. After the redevelopment, the hospital will provide more effective cures for patients, non-acute patients, and the emergency and outpatient department will also be expanded. We also provide more integration of Chinese and Western medicine, and there will also be a in-hospital service, for patients receiving Chinese medicines. There will be a new block of two-story new building within Kwangkwa Hospital, the Kwangkwa Museum, and also the Chui Chin Tong building built in 1999 would be built. The redevelopment plan will include the preparatory works and the main construction work. The first stage of the preparatory work began in March 2013. As for the site investigation, surveying, and the relocation work was mostly completed in 2015. The layout plan for the redevelopment project and the detailed design are also underway. Because of the large scale of the redevelopment and the complexity involved, the construction period will be quite lengthy. In order to better monitor the effectiveness of the work and to better ensure the cost effectiveness, we propose that the construction work will be carried out in phases so as to reduce the possible risks. We will carry out the main work, that is the demolition first, and we'll also demolish the 4-block hospital building, and we also carry out with the excavation and lateral works and other related works. The construction cost for that will amount to $1.2 billion. If members support it in the second quarter of this year, we will submit the funding request to the Finance Committee. Once the funding request is approved, we will immediately begin the demolition and the construction of the lower structural work. And we will also, in accordance with the progress of the construction work, brief LegCo and also apply to LegCo for funding to carry out the remaining phases of the work so that the entire redevelopment can be completed on time and as soon as possible. I hope that members can support this plan.
盡快咧展開有
So that we can start the demolition and substructure works immediately. There are 4 members who have raised their hands. Each member will be given 5 minutes. Dr. Kwokaki. Thank you, Chairman. I fully support this project. I hope it can be done as soon as possible. But the government has a different way of doing things this time. As for the construction time, originally it was 18 months and now it's extended to 107 months, 2 years more. So this will have a huge impact on the redevelopment. Well, as the chairman knows, now our hospital beds are over-occupied. There are foldable beds that have to be placed on in the corridors, outside toilets, etc. Hospitals are very crowded. So if the government lengthens the construction period, I really cannot accept it. And the tender is now divided into several stages. So first you would have to do the demolition first, and then you would do the construction at the second stage. Why do you want to do this? Why do you want to divide it into different stages? Now, if the contractors are different, would there be a problem? And for the redevelopment period, it's so long. So it will have a huge impact on not only Kwangwa Hospital, but the whole Kowloon West cluster. So what kind of plans does the government have to reprovision the beds affected? At Kowloon Hospital, so they have quite a low density development. So has the government considered this? That is, at the Kowloon Hospital, maybe you can add more beds in the long run. Well, in this year's policy address, we just heard old stories. We haven't heard about new ideas. But I think for the Kowloon Hospital Hill, there's a lot of potential. And it would be a better idea for the hospital authority headquarters to be relocated so that that sites can also be used for hospital. Now the construction period is 10 years, and that will have a huge impact on patients. Thank you for your question. As for this project, originally is targeted to be completed in 2022, and now it's extended to 2025, an extra period of 27 months. Why is that? Because originally the plot ratio was smaller. However, afterwards, we've discussed with the relevant government departments, and the plot ratio was relaxed. The hospital authority thinks that we should maximize the use of the site. Now we will be enhancing the scale of the new Kwong Wai Hospital, so the gross floor area will be 30% more. And of course that will mean that the hospital will be used in a more efficient manner. So why do we need more time? It's because we want to enhance the protection of Tonghua Museum, and relevant works have to be carried out, and that takes 10 months. If we want to expand our gross area, floor area, we need 17 by 30%, and we would need another 17 months. So in total, we need an extra period of 27 months. Now, why do we have to apply for funding in stages? If we apply for funding in one go, then the whole redevelopment design would have to be completed first before we call for tender. And now we are applying for funding in stages, so we can do things stage by stage. We have completed certain things first, and then we'll call for tender, so things can be done simultaneously. Otherwise, we may have to wait for 4 years before the detailed design is completed, and then we have to wait till then before we can call for tender. So now we can do other work first, for example, substructure, demolition, etc. This is to speed up the whole construction process. As for tendering in stages, it also has another advantage. That is, we would know the budgets better. For smaller companies, they can also take part in tendering, and it would mean more competition, and we may be able to get a better price. Now the construction time is longer. Well, because now the plot ratio is bigger, we will be having a bigger GFA, and it has nothing to do with the tendering exercise being divided into stages. It's because we will have a bigger complex, so that's why the construction time will be longer. So what will happen in the interim? Can Kowloon Hospital provide more services? Well, for Kowloon Hospital, now there are already facilities there for non-clinical service. Maybe Dr. Watt can tell you more. I can supplement. During the construction period, there will be arrangements made to the operation of the Kwong Wai Hospital. Well, we have promised that A&E service be maintained during the construction period. So now we are doing the construction in stages. The Kwong Wai Hospital is redeveloped because there is a serious shortage of space right now. We will have to maintain the operation during the construction. And at the same time, clinical services would have to be provided. So for our storage of medical record and for our backup officers, many of them are now relocated to Kowloon Hospital. They have a temporary building there for such facilities and storages. And for non-emergency services, some of them are also relocated elsewhere. For example, elderly service, a large part of it is now relocated to Wong Tai Sin Hospital. And also for rehabilitation beds, now they are removed from Kwang Wah Hospital. Some of them have been moved to Wong Tai Sin Hospital and some others to Our Lady of Marina Hospital. We will be keeping a close eye on our bed pressure, and also we will keep a close liaison with other rehabilitation hospitals so that we can make referrals. As for non-emergency services, we hope that we can enhance ambulatory care services so that patients do not have to be hospitalized. As for our Chinese medicine service, now is provided in buildings that are close to Kwang Wah hospitals. So we have adopted different methods to provide the same service during the construction period. Dr. Poon Siu Ping. Well, my concern is similar to that of Dr. Kwok's, and some of the questions have been answered. Well, you've told us that by dividing the construction period into stages, actually the whole process can be sped up. But now it will still take 9 or 10 years to complete the redevelopments. I think the services will definitely be affected. Well, you are trying your best to minimize that. I've heard what you said. Of course, I support this project, and I hope that Kwang Wah Hospital can be redeveloped as soon as possible. Now, for the first stage, you will be demolishing the nurses' quarters and the south wing of the main building, as well as the Chinese Medicine Clinical Research and Services Center. So you will also be making use of Kowloon Hospital for that. So do you have concrete arrangements in place already? Now, during the construction period, what can be done to minimize the impact? Now, you're saying that there is space at Kowloon Hospital. But whenever there are redevelopment works, I'm sure the existing services will be affected. This has happened to other hospitals, and patients will be influenced. Is it possible to further shorten the construction time? Have you thought about other ways to help that to do that? As for the redevelopment of Kwang Wah Hospital, is redevelopment in situ and is very complicated and time consuming, because first of all you have to demolish certain buildings, and then you have to do the substructure, you have to remove the facilities above it, and then you have to move them back. So it takes a lot of time and work for the demolition, reconstruction and reprovisioning. As Dr. Watt said just now, the principle is that for clinical services and emergency services, they will not be affected and they will be properly maintained. As for non-emergency services and non-clinical services, they will be relocated to other places. We will make use of other hospitals for the moment. And if there is a need, we may need to use other methods. Maybe Mr. Lee can tell you more about the construction time. I hope members can understand that this project is very complicated because it's an in situ redevelopment, and the hospital has to operate during the construction. The new Kwangwa Hospital will be 50% bigger than the Queen Elizabeth hospitals. So imagine this. You have to demolish a hospital first, and then you have to rebuild a big hospital. So it's like you are building 2 hospitals. So if you build it takes 4 to 5 years to build 1 hospital, then now we are building hospitals, so it's about 10 years. As we explained just now, we are doing this in stages. We hope that while we are demolishing some of the buildings, we are finalizing the detailed design of the other parts of the hospital. So one stage will last for 4 or 5 years. That's the fastest. I don't think there's room for further shortening the construction time. We just hope that we will not see many unforeseen problems.
Chairman, of course, I very much support the redevelopment, and we can understand where your difficulty is, because you want to provide services and yet carry out the demolition at the same time. But the whole thing drags on for 9 years. That's a long time. I think that isn't a very good option for the district and the hospital. If you want to, keep providing services while construction demolition gets underway, and that may make it difficult for you to compress the period. But would that be an alternative option? That is, for example, speed up the construction of the Kai-Tak hospital, because there, you don't need any demolition, and you can just transfer part of the patients from Kwangwa to the Kai-Tak new hospital. Would it be better than actually carrying out the redevelopment work at the site over a 9-year period? Because it's a big nuisance to the Kwangwa staff. Is it possible for you to have another option that can actually expedite the process, Undersecretary? Thank you, Dr. Wong. Right now, for HA, actually it has actually consider various options. I think the latest option is the quickest way. Of course, we know that it takes up 9 years, but maybe later on Dr. Watt can supplement. It's not that we won't have anything ready till 9 years later, but maybe Dr. Watt could supplement. Chairman, I was asking just have you considered another option, that is to expedite the construction of the Kai-Tak hospital so that some of the Kwangwa services can be provided there as well? People who don't want to travel long distance can go to Queen Elizabeth Hospital instead. That would actually make way for the construction work at the Kwangwa Hospital site. So maybe Mr. Lee, could you explain further? That is under HA, what progress has been made for the Kai-Tak Hospital. Mr. Lee? Yes, just for the Kai-Tak Hospital, it is only a project with preliminary plan. And I think the entire project for that would not take less time than the redevelopment of Kwangwa Hospital. But one point that I'd like to make is that 9 years refers to the entire redevelopment, that is the completion. But the phase 1 of the hospital redevelopment will be done much earlier, years earlier, and it will provide actually much more space than what's available in existence. By 2021, Kwangwa Hospital will see marked improvement, and in the long run, when the second and third phases are finished, the size of Kwangwa Hospital will be expanded by 1.4 times its present size. Any timetable for the Kai-Tak Hospital then? Can't you expedite the construction work there? Yes, as Mr. Lee said, the Kai Tak site has only got preliminary planning at this stage. And for Kwong Wah Hospital, if you recall, back in 2013 we came here for funding, up to $500 million to carry out the preparatory works and design for the project. And so the whole project actually was kick-started then. As Mr. Lee said, if we use Kai Tak instead at this stage, where Kai Tak Hospital is just in the preliminary planning stage, so it won't actually shorten the time period at all. The phase 1 work, when it's done, of course, the entire redevelopment will not be finished by 2025. But when the first phase is done, the construction floor area is already up to 145,000 square meters. So that's much bigger than the existing hospital already. And the new block will be able to provide 1,000 beds, which include actually services we want to see expansion in, for example, emergency rooms and also ambulatory services and also daytime care and so forth. So by 2021, all those services will be provided. Chairman, I used to suggest to the Secretary or to the Bureau that I hope that there could be an underground tunnel linking the Yaomate MTR to the Kwong Wah Hospital, so that people won't have to cross the streets on their way to the hospital. So that could be better linkage. So does the current design include the underground tunnel that we proposed? So Mr. Lee, please. Yes, in preparatory works for the Kwong Wah Hospital plan, it includes linkage to actually a feasibility study on the linkage to the Yaomate MTR exit. But we found that there could be two options. One is a linkage to Big Street and the other is to have the linkage through Waterloo Street. But we found that underground, beneath a big street, there are lots of facilities or utilities already, so it's very difficult to construct a linkage. For Waterloo Street linkage, even though the distance is longer, but since any underground tunnel would need a ventilation system, and there needs to be a tower for ventilation, and we have yet been able to find a site to put the ventilation system tower. So we are still carrying on with the feasibility study before we can come up with a definite answer. Next one. Yeah, Kwong Wah Hospital is quite a good hospital, but it is really old. Therefore, we do see the need for it to be redeveloped. But during the New Year period, you can see that all the emergency departments, the emergency wards are actually full. So we've noticed that the same problem, long queues actually are common with Kwong Wah Hospital. In the evening, particularly during the New Year period, the congestion is even more serious. Night consultations in Mong Kok and nearby areas, there are lots of night clinics because of high rents that have been closed. Therefore, residents in the area have no other choices but to go to Kwong Wah Hospital for night consultations, and that puts a lot of pressure on the emergency wards at Kwong Wah Hospital. And now with the redevelopment, there could be impact on the emergency outpatient services. I would suggest that for the non-acute patients, who are maybe just going to the emergency department for an injection, or they will only need actually medicines alone. So maybe we can suggest that the government can find doctors and get some doctors there at the emergency ward to handle these patients who are in need of outpatient services alone. But it seems the government has not moved in that direction. Will the government consider it then, particularly for Kwong Wah Hospital, now that with the redevelopment coming up, can they consider, dispatch doctors to the emergency wards to provide more services? Or if you don't have enough space, could you maybe provide mobile clinics so that in busy periods or peak hours, try to provide outpatient services on the mobile clinics? so that the public members of the public will not have to wait for hours to get the medical attention they need. Of course, for Kowloon West, including Cornwall Hospital, all along, they've been in contact with district councils, to try to do an assessment of the needs for services. I think now with the redevelopment plan, I'm sure the hospital has a detailed plan to try to minimize the impact on services. Your suggestion of, say, for general outpatient services, maybe I'll ask Dr. Watt to actually brief you on their upcoming arrangements. Dr. Watt? I think during the period of redevelopment, I agree with Mr. Chair, what you said just then, that there's a lack of space in Cornwall Hospital. During the first phase, the emergency ward, because of the limited space, we will not make any change to it. But I know that to ease the pressure on the services, we will reevaluate the demand and see how we can ease the pressure further. Your suggestion of a mobile clinic, I think it would really depends on the type of diseases to be treated. If the mobile clinic is too far away from the hospital, then it may be too far, for a patient to get support from the hospitals. I suggest that you can have a mobile clinic right outside the hospital, and for non-acute cases, for cases where injections is the cure, then you can try to provide those mobile services. Yes, I understand. We can ask. In the community, there are 3 major streets, surrounding Cornwall Hospital, and so we need to find where we can find the spot, to put a mobile clinic, and we will have an overall review of the situation. Fernando Zhang, of course, we definitely support the redevelopment, but we do hope that it can be done as soon as possible and finished at the earliest. And also during the period, we hope that we know there's a big demand for services and there's huge congestion because the redevelopment is being done in situ, so there will be a lot of difficulties. But then there's mentioned that there's an extension of 27 months. And the Secretary said that that's due to the large scale of the construction site, which is 3 times more than earlier. And also, you need to keep the Tonghua Museum to preserve it so that it can be better renovated. But I found it strange that why can't you do both in parallel instead of one after another? That is 10 months and then 17 months later. If you do 2 things in parallel, you could save 10 months in total. I'm not familiar with engineering, and I'm not actually an expert in hospital organization either, but can't you do both things at the same time? And I've also heard or read from news reports that there's the congestion is so serious that even rooms, storage rooms for fishes, and also corridors outside, operating theaters, those places are also where beds could be found, and even in operating theaters, outside operating theaters, shoes of hospital staff are placed there, items that should be separated, for non-contamination purpose can be found if they are strewn on the floors. And other unwanted items are also found in staff room and toilets. Have you seen those reports and the pictures? That really made me worried. I'm not blaming the hospital for it. I know it's very, heavily congested, particularly during the New Year period. Congestion was particularly serious. I'm very sympathetic with that. But do you have other, better ways for storing items? Or are there any nearby spaces where you can rent to store those items? If you need extra resources, just let us know. If you have extra needs, let us know. We can tell the government. Hopefully, the Bureau can also try to support you and apply for funding from LegCo. We always support, the need for extra resources. Please don't, because of limited resources, make things difficult for the hospital staff and also the patients. So if needed, please voice out.
So what is the condition like? Is it disastrous? Thank you, Dr. Fernando Zhang. I would invite Mr. Lee to explain to you why our project has to be carried out this way. Now, maybe let me explain to you about the works procedures. Now, in order to protect Tongwa Museum, we have to add 40 big piles. So when we build the foundation, we have to do that. But now, because there will be 40 more piles, so we need some more months. And also, to enhance the Tongwa Museum, we have talked to the AMO, and the new building would first be elevated. The new building will be elevated so that the pedestrians can see the museum from Waterloo Road. And there will be a 30-meter span steel structure, and that would add 6 months to the construction period. So a total of 10 more months, and after doing that, we will build a superstructure. Because the GFA has increased by 30%, we need 17 more months. So adding these two together, there will be an additional 27 months. So technically, these procedures cannot be carried out at the same time. So that's why the construction period cannot be shortened. Maybe Dr. Watt can explain to you about the storage. Now, for the frontline staff, they will be working in a very poor environment then, right? Now, for our frontline staff, yes, now they are facing a lot of difficulties. Well, I would like to thank our colleagues for their contributions. They have worked very hard, and they have been very patient and accommodating. I think I would like to really praise them here. We didn't have enough space, and now we have even less. The problem is even more serious during redevelopment. So for storage, now we are making use of logistics to help. For items that are not used, they would be stored or discarded. And for items that are constantly used, if some of them are not being used right away, they will be stored elsewhere. So whenever we receive a request, we will respond immediately, but we won't wait for our problems to occur. So there are more communication channels, and there are more interactivity with staff. We hope to understand the staff's difficulties, and we will try to help as fast as possible. Sometimes staff may not know how to solve space problems. So we are now making use of logistics to help resolve the problem of storage. Now we have new arrangements. Our colleagues may not be familiar with them. For example, in the past, when staff want to take a rest, or when they want to go out for a meal, they may find that the rooms they used to go to are now sealed. So now we have more communication channels. We have regular meetings. We would update them of the latest situation, so that there can be exchanges of views. Of course, I'm not saying that we can resolve all problems, but we would always be discussing and reviewing the situations with our staff. I have seen the photos. I don't think they are fabricated. So I hope Dr. Watt or the HA staff can help improve the situation. I'm happy to hear that Dr. Watt is constantly communicating with the staff. That is a very efficient way of solving problems. The staff may not know about your new arrangements, for example, using logistics to help resolve the storage problem. And some of them may still find difficulties unresolved. So I really hope that there can be more communications in the hospitals, because there are many frontline workers. For example, hospital assistants. I've heard that there is a huge brain drain problem, and the brain drain rate is double digits. It's like 18 or 19%. So I hope that there can be more communications. Mr. Chen Kinpo, of course I support the redevelopment, because the hospital is now in a very poor condition. And you are saying that in the second quarter of 2016, you will be seeking funding from the Finance Committee. You assume that you can get the funds in the second quarter of 2016, and the works can be completed by the end of 2018, but you know that there is a congestion at the FC. So if it takes another 6 months for you to get the funding, would the whole project be delayed by 6 months? Now, if we can start the works in June, then it would be 2025. And if it's another 6 months, then the works will be completed 6 months later. So if, unfortunately, the FC drags its feet, then what will happen? So you will just delay? Yeah, there's no other way out. I hope members can help. But of course, internally, the government has to do something. Maybe you should accord a higher priority to this project in the queue. Well, the government is very active in redeveloping old hospitals and building new hospitals. So how about private hospitals? Under Secretary, you have a 100 billion projects for that. I'm happy to see that, because Hong Kong's healthcare can be bettered. But Hong Kong's population may be growing, and also there are people coming to Hong Kong for healthcare services. So I want to know, will the government increase the number of beds and enhance your services? As for private hospitals, the Secretary has talked about it many times. For private and public healthcare services, we hope that we can adopt a two-pronged approach. For private healthcare services, there can be private hospitals and outpatient services. Earlier on, we had a Wong Chuk Hang site, and a new hospital will be built there. And earlier on, we also supported the Chinese University of Hong Kong to build a teaching hospital. And each of these two hospitals will have about 400 beds. So in total, there will be about 900 to 1,000 additional beds. Some of the private hospitals are also expanding and adding beds. So in the coming 8 to 10 years, there will be many more hospital beds. For private hospital beds, in the coming 8 to 10 years, there will be a significant increase. In terms of manpower and facilities, of course, we must provide them as well. At the FC, the 100 billion funding application is still waiting, and that fund would be used for acquisition of private services so as to help the HA shorten its waiting time. Yes, there is CU Hong Kong Hospital and Wong Chuk Hang private hospital. That's good, but it takes years to build a hospital. So I hope that I can continue to hear good news from you. Dr. Fernando Zhang, I have a simple question. I'm worried about congestion. Actually, this is not the real problem. If Mr. Chen Kim-po is willing to put this project in front of other projects, then it will get approval right away. But I don't think Mr. Chen Kim-po will do that. So now it goes back to the government. I'd like to ask the Undersecretary. Of course, we want to approve the funding for the redevelopment of Kwong Wai Hospital as soon as possible. So is it possible to accord a higher priority to this project? Can we pass the livelihood projects first instead of fighting over the express road link? Well, as part of the government, we will have to respect the arrangements of the Treasury. Well, of course, we understand that for this project, it has certain urgency. And if the works cannot be carried out in time, there will be a number of problems. For example, the public may be disappointed, and if the project is delayed, the construction costs may go up. And originally, we wanted to provide better and more efficient service to the public, but that would also be delayed. Of course, from our perspective, we hope that the project can be passed as soon as possible. So the Food and Health Bureau does not have the power to accord a higher priority to the redevelopment of Kwong Wai Hospital, right? It's decided by the Treasury. Well, we would have communications. If we have a need, we would tell the Treasury, but of course we would respect its final decision. Chairman, I hope the Food and Health Bureau can fight for it. We only have one government, and if the Food and Health Bureau thinks this is an important project and it knows that consensus have been reached at LegCo, I hope that the project can be submitted to the FC as soon as possible. And I also hope that Mr. Chen Kim-po, the chairman of the FC, can accord a higher priority to this project. I would like to remind members, well, please let me finish. For this project, it has to be discussed here first, and that it will go to the PWSC, and after that it will go to the FC, so it's not that fast. I haven't heard any objection today, so this project will be submitted to the PWSC. Mr. Chen Kim-po, well, the FC has been respecting the arrangements of the government because the government coordinates all its projects, is in the best position to decide which project will be submitted to the LegCo first. So in history, we have always been respecting the government's arrangements. So if we make our own changes and the government doesn't agree, then the government would just withdraw the application. So I don't think that's an appropriate way of doing things. I don't think we should be confrontational. We should cooperate with each other. If the government really wants to have the XRL project passed first, it would take away all the other projects and force us to pass the XRL project. So don't think the chairman of the FC has all the powers. And also, I have a suggestion for the government. Well, the XRL really has a deadline. If you do not approve the additional funding, a lot of people will be affected. The project would have to be suspended, and there will be extra expenditures. So I've talked to the governments. That is, after the XRL has been passed, I hope they would adopt a two-track approach. That is, there will be a fast track and a slow track for funding application. But I'm still worried that members would object to that. I hope Dr. Fernando Cheung can convince other members. If there is a fast track, please do not drag your feet, because some projects really have to be passed as soon as possible. Otherwise, Hong Kong people will lose out. Hong Kong's public money will lose out. I'm sure there are more good people in our council than bad people. We have very good intention. We just want to solve the problems.
Well, luckily this is the Health Services panel, and we're discussing the Kwong Wah Hospital redevelopment. And luckily, I haven't heard any voice of not putting this paper to PWSC. Well, I think members here all agree to that we should submit this item to PWSC. Well, and as for the other matters, well, I think we're clear that with no objection to actually submitting this Kwong Wah Hospital item to PWSC. But please remind you that members are concerned about your paper. You are now building the hospital by giving it an additional 30% space. So please give us a checklist of what additional facilities there will be in the expanded version of the hospital. So when you submit this item to PWSC, please include the information in your paper, and also in your upcoming paper. Some of our colleagues have asked you questions about, when would see what facility being completed, and when will some facilities be available. So please provide, in that paper a list of the facilities to be completed and their timetable as well. That could actually minimize misunderstandings, okay? So if there are no other questions, then it's very good. At the start of the Year of the Monkey, we can finish this today's meeting. Actually, and this item indeed 10 minutes before the closing time. So there's no AOB, so meeting adjourned. We'll meet again in March. Thank you.